Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about an anterior lumbar interbody fusion, otherwise known as an ALIF. Now, please keep in mind that these videos are meant for patients being treated at this practice. Other practices may do things differently. Please keep in mind that this video is just a generalization, and each patient's outcome may vary and the experiences may differ. When it comes to spine surgery, there are many different approaches a surgeon can take to access the lumbar spine. In this particular surgery, the surgery is performed from the front. Now, to get all the internal organs out of the way, a vascular surgeon is used to provide access to the spine surgeon. The vascular surgeon may make one of two incisions. A horizontal incision can be made for the lower lumbar spine. This incision is cosmetically very pleasing. Sometimes a vertical incision is made to access multiple levels in the lumbar spine. As the vascular surgeon performs a dissection is made through the skin, the muscles are dissected, and once the internal organs are appreciated, they are moved over to the side, paying very close attention to all the blood vessels that are in the area, and ultimately the spine is exposed. Once the spine is exposed, then the spine surgeon will take over the surgery. Now that the spine is exposed, the spine surgeon will begin to work, and the first step is to remove the disc in its entirety. This can be a very simple or complex step in the surgery depending on how severe the disease process is. Once the disc has been removed entirely, a cage is placed in between the vertebrae like so. This cage provides biomechanical support for the spine. Once the cage is in place, it is secured with a couple of screws or nails that go into the vertebral body. The cage is also filled with bone product so that the fusion can occur over time. Once this part is completed, the vascular surgeon will close up the incision. Once the anterior part is complete, the patient is flipped and laid on their belly, and then screws are placed in the spine percutaneously through tiny incisions. So for example, if the cage is right here from the front, we would put screws right here and connect them with a rod, and this completes the fusion. Over time, bone will regrow in the area where the cage is and where the rods and screws are. Here's an example of a spine model with an anterior lumbar interbody fusion. Notice the large cage that has been placed and it has been secured with screws. And then in the back of the spine, you can see the screws and rods that have been placed to complete the lumbar fusion. Although that this surgery may involve incisions in the front and the back, the post-operative pain can be quite minimal and the surgical results are excellent. This surgery can last anywhere from 2 to 4 hours depending on the complexity. The patient is usually in the hospital for a couple days after surgery. They do get a back brace to wear after surgery, and the back brace is used to when the patient is up and about walking around. Ultimately, the patient comes back to the office at 2 weeks where the incision is checked, and then physical therapy is started. The purpose of therapy is to develop core strength and range of motion to regain normal function and get back to normal. Patients are cleared to start driving anywhere from 2 to 4 weeks after surgery, and that includes work as well.